Today we will be discussing Behind the Needle, the science and the safety of Botox. In this video, we'll be covering what is Botox, pharmacokinetics and pharmacodynamics, onset and duration of Botox, toxic dose and potency, adverse effects and precautions, antidote and management of toxicity, and a case study about botulism outbreak from illegal Botox in Sydney.
Hello, our group will be present about the Botox. My name is Bill. So what's Botox? Botox injections are made from a toxin produced by the bacterium Clostridium botulinum, which is a spore-forming, anaerobic, and a gram-positive bacterium. They can cause life-threatening type of food poisoning called the botulism. Botox injections are developed from the purified and a heavily diluted botulinum neurotoxin type A. They are a group of 7 serotypes A to G. 4 of them are prepared for the practical use. They are 3 forms of serotype A and 1 form of serotype B. For aesthetical purposes, all 3 forms of serotype A are used for the wrinkles and the facial lines. In the picture at the right corner of the slide, so structurally, Botox toxin are the protein complex composed of heavy chain with the 100 kilodaltons and a light chain with the 50 kilodaltons. They are linked together by the disulfide bond. So let's take into the background on Botox. Botox, scientifically known as botulinum toxin A, was invented in the 1970s by the Dr. Alan B. Scott. He is an American ophthalmologist who began experimenting with the botulinum toxin type A to weaken the overactive eye muscles. In late 1980s, the cosmetic potential of Botox was discovered. Dr. James, a dermatologist, and Alastair Carruthers, ophthalmologist, noticed that patients who were treating for eye muscle disorder also experienced reduced facial wrinkles. So in 2002, FDA later approved it for the cosmetic uses.
My name is Harvey and I will be discussing the pharmacokinetics and pharmacodynamics of Botox. When it comes to pharmacokinetics of Botox, we will be using the ADME model, which is absorption, distribution, metabolism, and excretion. In terms of absorption, Botox is administered by injections. In terms of distribution, zinc proteinase, which is found in the light chain of Botox, will attach to the receptors on cholinergic nerve terminals. When it comes to metabolism, the light chain in Botox will be metabolized in the neuron. And finally, when it comes to excretion, the Botox that is not in the neuron will be cleared by the liver. Pharmacodynamics of Botox. Zinc proteinase will split its nerve protein, which will block the release of acetylcholine from neuromuscular junctions and relax the muscle. It will require 2 weeks to have full efficacy, and it will last around 3 to 4 months in the system. In order to prevent Botox from irreversibly binding to the nerve terminals and causing systemic spread, it needs to be administered in intervals.
The time to onset refers to how long it takes for a patient to first notice the effects of the Botox injections. The average onset time for Botox for most patients is around 6 days. However, various conditions can cause different onset times. There are several factors that can affect onset time. For example, the patient's age, the dose of the Botox, and other factors such as sex, years of treatment, type of toxin, and clinical conditions. However, these factors were analyzed and showed no significant effects on onset time. The duration of Botox is typically around 78 days. However, it can range anywhere between 15 to 180 days. The duration of Botox can depend on different conditions. There are many factors that influence the duration of Botox. For example, the dose and type of Botox.
Adverse effects of Botox. We have common or expected effects. Pain, swelling or bruising, known as ecchymosis, hematoma, whereby blood lump form under the skin from bleeding. You can see this in figure 1. Headache, temporary droopy eyelids, or localized pain from needle injections. Serious or delayed effect of Botox. Rare but can still happen in some cases. Dysphagia, which is known as difficulty swallowing, as you can see in figure 2. Systemic anaphylactic shock, which is severe allergic reaction. Severe respiratory failure, blurred vision, dysarthria, which is known as difficulty for speaking, or dysphonia, where your voice changes.
Let's talk about toxic dose and potency. Potency refers to how much of a substance is needed to cause a biological effect. Something with high potency works at a lower dose. Toxicity, on the other hand, is about how harmful the substance actually is. One of the most potent and deadly substances known is the botulinum neurotoxin, produced by Clostridium bacteria. It can cause severe paralysis, and even small amounts, as little as 1 nanogram per kilogram, can be toxic if injected into the bloodstream or muscle. However, the potency of these toxins can vary. It depends on factors like the toxin type, purity, formulation, how it's administered, and even the species tested. Lastly, some quick toxicity tests use very high doses that don't reflect real world exposure. So we need to interpret those results with caution. Now let's look at some important concerns related to toxic dose and potency. First, safety margins. The recommended doses for adults are usually only around 2% to 10% of what would actually be dangerous. So even when higher doses are used in some patients, they're still far below toxic levels and haven't shown a big increase in side effects. Second, there are inconsistencies in dosing, especially between adults and children. For example, children can end up receiving 200 to 300% more than adults per kilogram of body weight, which doesn't really make sense. Lastly, we see cases where the same dose is given to people with very different body sizes, like a small child and a full grown adult. This raises concerns about whether current guidelines are truly appropriate for all age groups. Now look at the clinical symptoms of toxicity. These symptoms usually begin to appear within 3 days after exposure. Some of the early warning signs include difficulty swallowing, hoarseness, slurred or slowed speech, and double vision. As the toxicity progresses, it can lead to more severe effects like descending flaccid paralysis, where muscle weakness spreads downward, and in the worst cases, life threatening respiratory compromise, which can make it hard or even impossible to breathe. These symptoms highlight why early detection and treatment are so important.
Precautions of Botox. People that should not use Botox. Firstly, pregnant or breastfeeding women. It's not recommended due to the lack of studies. However, there has been studies done on mice which show possible fetal abnormalities, which is why there's still no human trial that is being done. Secondly, people who are allergic to Botox. People who are allergic to Botox, once they have been come contact to Botox, they will trigger allergic reactions such as hives, wheezing, itching, or swelling of the lips, face, throat, and tongue. They may also feel faint. Lastly, people with nerve damage or skin infection. Botox may worsen nerve damage or spread infection if injected into the affected area. Precautions for aftercare, which is to take note after Botox procedure. So there are 3, starting with the first one, no alcohol. Without alcohol, it reduces the risk of bruising after the infection. Secondly, do not touch your face to prevent the spread of toxin. Third, avoid other skin treatment. Botox takes time to settle in. Skin treatment may reduce the Botox effectiveness, and it may also disrupt Botox on your skin.
Antidote and management of toxicity. There's been no known antidote for Botox which can reverse its effects. However, there are a few ways that help with Botox complication and counteract these effects. How Botox works is that it prevents muscle contractions by blocking the release of acetylcholine from the nerve terminal at the neuromuscular junction, and this sometimes could result in complications such as severe dysphagia, which is difficulty in swallowing, dyspnea, which is difficulty in breathing, autonomic symptoms, and botulism. So these are the side effects that patients have faced after taking in doses of Botox, as it prevents the muscle contraction and freezes up the muscles. So some substances that could help and counteract these effects is pyridostigmine and botulinum antitoxin. So firstly, pyridostigmine is a substance that prevents the breakdown of acetylcholine and increases the amount at the neuromuscular junction, which produces neurotransmitters for the muscles. The production of neurotransmitters encourage muscle contraction and prevent the freezing of the muscles caused by Botox. Next is botulinum antitoxin. It is a treatment for botulism, as it blocks the neurotoxin produced by the bacterial species Clostridium botulinum. So the neurotoxin produced by this species causes respiratory and muscular paralysis. So this antitoxin is a treatment for it.
This is Our case study of Botox, which is also botulism outbreak from illegal Botox in Sydney. 3 patients were harmed after receiving suspected fake Botox at unlicensed premises. All 3 were hospitalized and one of them was actually admitted to intensive care unit. They all developed botulism, a rare but deadly illness. Botulism is caused by a neurotoxic protein called botulinum toxin, which is derived from the bacterium Clostridium botulinum, which is the same toxin that is used to make Botox. So the symptoms of botulism is blurred vision, muscle weakness, and also trouble breathing. The authorities suspect that the cases were caused by counterfeit or mishandled Botox administered by unlicensed or inexperienced injectors. So case studies like this serve as a warning about the life-threatening risk of using Botox improperly or receiving it from unqualified providers. So it also acts as a reminder of potential side effects of unlicensed cosmetic injections and also to be aware when receiving cosmetic injections and also receive them from authorized practitioners only.